Many patients come to Facialteam after undergoing forehead reconstruction elsewhere, with results that didn't quite meet their expectations. Whether it's due to visible deformities, functional issues, or simply not achieving a feminine forehead and expression they had hoped, we understand how difficult and emotional this experience can be. That's why we developed our 4-contour redoing procedure to help set things right. In revision surgeries, we see a wide range of challenges. In many cases, the main issue is that only a simple bone shaving was performed, an approach that may seem less invasive, but is often not enough to achieve a truly feminine result. This limited technique can sometimes lead to complications, like areas where the bone becomes too thin or even develops holes, exposing the sinus underneath. Sometimes it can even result in the complete loss of the front wall of the sinus, leaving that area totally unprotected. Another frequent problem is the use of synthetic materials, such as bone cement or implants. Unfortunately, these materials can cause infections or visible distortions, and in most cases, they must be removed. But beyond the structural issues, what matters most is how these results affect a person emotionally. In many cases, the areas most important for gender identity, especially around the eyes and the center of the forehead, still retain masculine characteristics. In addition, visible scarring along the hairline, which is unfortunately common in some techniques, can further compromise the final result and become a constant reminder of the surgery. For someone seeking harmony between how they look and how they feel, this can be deeply distressing. The treatment begins with a high-resolution 3D CT scan that is performed to obtain a detailed assessment of the cranial and facial structure. With Facialteam's surgical planning software, we first analyze and measure the affected area. Based on this, we design a customized surgical guide that replicates the missing frontal sinus wall. This guide is then 3D printed and used during surgery to harvest a bone graft from another area of the skull, perfectly matching the shape of the defect. The surgical procedure starts by choosing the optimal area for the incision, according to the patient's hair density and quality, in order for any future scar to be completely hidden. Then, we perform the incision along the chosen area, where a strip of scalp is removed. Later, we'll explain how hair grafts from this strip may be used on the same day for hairline feminization and for helping to cover previous hairline scars. Through this incision, access is gained to the frontal bone and skull. The main landmarks of the forehead are contoured to achieve a definitive feminine shape, while the frontal sinus is prepared to receive the graft. At this stage, the 3D printed surgical guide is securely fixed to the skull, guiding us to harvest the exact fragment of bone needed to rebuild the missing frontal sinus wall. Using ultrasonic bone cutting technology, we perform a precise and controlled osteotomy along the guide's edges. This advanced technique allows maximum accuracy while minimizing trauma to nearby structures, which is especially important in such delicate areas. The bone graft is then removed together with the guide, refined, and prepared for reintegration into the forehead. Once ready, it is placed into the prepared sinus cavity and fixed with micro screws for long-term stability. Finally, to protect the donor site where the graft was taken, a custom-fitted titanium mesh is applied. This ensures structural safety and preserves stability over time. Following this type of reconstruction, patients experience significant health benefits, including the restoration of the forehead's natural shape, ensuring that deformities are corrected while the underlying cranial structures remain protected. Now, let's go back to when we removed the strip of scalp to talk about the hairline. In many cases, prior forehead surgeries also did not account for scar concealment, leaving visible frontal hairline scars. By performing simultaneous hair transplantation, SHT, with follicles harvested from the previously removed strip, these scars can be effectively treated. First, a team of technicians extract the follicular units from the strip. After grafting sites are prepared, follicular units are transplanted to conceal scars and feminize the hairline. Facialteam's forehead redoing and hairline feminization techniques prioritize both aesthetic precision and long-term functionality. Our approach ensures the correction of any deformities and the refinement of the forehead contours to create a more harmonious and feminine facial structure. For contour, envisioning forehead surgery.